I'm Kathy Lee Sepsic. I'm the CEO of Phemsys, a company I founded in 2004 with an explicit desire to transform women's healthcare with very disruptive technologies. Phemsys is a publicly traded company, traded under the symbol FEMY on the NASDAQ, and this presentation will contain forward-looking statements. Phemsys' broad portfolio of products are designed to empower women with choices. We are finding ourselves disrupting key critical areas within women's health that serve multi-billion dollar global market opportunities. And we are here to improve patient care as well as overall healthcare economics by expanding practice care options. There are three major differentiators here at Phemsys. In each of our products, we see minimal competition due to the lack of innovation in this sector. We are commercial ready as a company. We have been manufacturing for well over a decade as a US manufacturer, and we've achieved global regulatory approvals in the US as well as Europe and other countries around the world. We have a strong foundation with an experienced leadership team and an intellectual property portfolio that includes over 200 patents that have been issued globally to protect our portfolio. We have commercialization efforts underway for the first time in 2024. So when you have less sperm to work with, which unfortunately is a worldwide dilemma, it's been established that less than 50% sperm counts exist in all male age categories around the world. This is a problem that's going to continue.
So Femicide is the next stage, and it's a similar type of catheter. So it's similar to an insemination catheter as far as the discomfort that patients will go through with an insemination, which, if it's done very gently, is minimal discomfort for the patient. The catheter forms a seal at the opening to the fallopian tube and allows us to put the sperm directly into the fallopian tube. You can choose one side or both sides to insert the sperm into. And what's so different about that is, rather than just releasing the sperm into the uterus, where much of it is not going to make it into the fallopian tube, and some of it's going to leak back out through the cervix, we're delivering the sperm directly to the tubes, which will carry it down to the ovaries and the eggs. This study was done with oligospermic patients, meaning very low sperm counts, but the pregnancy rates were quite incredible. Traditional fertility rates with insemination is less than 10%. With the population they looked at within the study, it was about 6% standard routine intrauterine inseminations. And with individuals with very low sperm counts, which we almost will never advise to do artificial insemination, they had a pregnancy rate of 24%. Wow. So quite a game changer.
Carrie, I'm just curious from your perspective, tell us from your clinician standpoint what you think about it, what your experience is.
I think it's really helpful to give people an option that otherwise would have to go straight to IVF. And like we see people wanting to do IUIs, I do think it gives patients a greater degree of comfort of, okay, we're going to do this once or twice, and if it works, awesome, and if it doesn't, we're going to stop doing something that is not working on you and move forward. So I think that's a benefit of it as well.
So shifting gears to the other end of the spectrum, our non-surgical solution for permanent birth control has approval in Europe. First approval anywhere in the world.
I see that your company is also working on a permanent birth control option. What can you tell me about that?
So as your opening said, this is the first of its kind. We are a permanent birth control option that is non-surgical, but we also don't rely on hormones, and we don't leave behind a permanent implant. So this is very different than the approaches that have come in the past, and we're trying to bring an option to women so that they can walk in their office, have an accessible option, and walk out the door and hopefully enjoy the permanent birth control aspects that relieve them of having to worry about contraception. So that is the goal. We leave her with her own tissue ingrowth as the ultimate result. So it's the safest approach. Our safety data is amazing. We're working through our final phase now from a clinical trial perspective, and we're recruiting patients at select centers across the country, but really dedicated to continuing this work and bringing this option to women, particularly post a DOMS decision.
Are there any side effects to this?
We've seen minimal. Most of it is very transient at the first day of the procedure. So anytime you go into the patient, into the uterine cavity, you might have some cramping, a little bit of spotting. That's to be expected. We have 5-year follow-up data on our earlier trials, and we don't see any additional concerns, no serious adverse events. And that's pretty unique in an area where we've seen other issues, safety concerns around other technologies. And this is to be an alternative to the only option that's available for women today, which is surgery.
I do want to share with you some insights and some observations that I personally had with the FemBlock system and with FemView, which is the confirmatory component as well. And perhaps just starting with the bottom line here, as a clinician who has performed these procedures, and I'm sure there'll be a slide about this later, these are easy to do. And they can be done in the office with the kind of equipment that almost every gynecologist has in their office today. And beyond that, even no real special training beyond what one gets in residency is really required for these procedures these days.
We've seen multiple states, especially in the South, pass abortion restrictions. Alabama even moving to ban IVF treatment. Of course, your therapy, you're saying, and treatment would be different than IVF. But what is your stance and what is your message to women during Women's Health Awareness Week, as abortion and reproductive rights collectively for women does become more of a politicized issue?
Yeah, it's, again, I try to look at the silver lining. This is a moment in time where we're actually all focused on women's health and we're talking about it and we're all recognizing that there's a lack of innovation. It's been a difficult space to navigate from many regards, whether it be fundraising or regulatory. But we as a company, we feel that the silver lining for us is we're out of the fray. No woman wants to find herself with an unintended pregnancy and have to make those decisions. We want to bring better healthcare where she has a choice to do something about it, where she doesn't have to go to surgery and have those inherent risks. When we look at the flip side of creating lives, we're here to bring a lower cost option so people will come off the sidelines and move forward in their care. So when we look at embryo maintenance and how long they're going to have to pay for the care of embryos sitting in freezers, we want to try to enhance natural fertilization. And we feel like we're in a unique position that we've been working on this for so long that this is a moment that we can bring these options to women where they're not engaging anyway. Give them options and choices. So this concludes our presentation. Thank you for listening, and hopefully you will support Femisys in our mission to transform women's healthcare with incredibly important technologies that are very much long overdue.